Hello everyone, and welcome to today's webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. Today's webinar, presented by ISPCAN Counselor and Past President Jenny Gray, focuses on the importance of positive parenting in the prevention of child abuse and neglect. Ms. Gray will explore the relevance to practice of findings from an international study by ISPCAN on promoting positive parenting, as well as identify practical ways of improving parenting to achieve positive outcomes for children. Right now, I have everyone on mute to avoid background noise. We welcome you to enter your questions and comments in the chat box throughout the presentation. At the end of the presentation, Jenny will answer any questions as time permits. Jenny Gray trained as a social worker in New Zealand and has been in children's services, social work, management, and policy development since 1979. She joined the Department of Health in England in 1991 and led the development of new inspection methodologies. In 1995, Jenny was appointed as the professional advisor to the British government on safeguarding children. Jenny held this post until September 2012. Since then, she has been a social work consultant. Jenny, thank you so much for being with us today and for your many years of dedicated work protecting children. Now I will turn it over to you.
And do I need to press change presenter, or am I good to go, please, Heather?
We can see your screen. If you want to put it in presentation mode, it'll just make it a little bigger.
Okay. Hang on. Is that better?
That we can still see, we can see the main slide and then one next to it. There we go. That's perfect. Thank you.
And I'm good to go now?
Yes.
Thank you. Well, thank you. Good morning, good afternoon, good evening to everybody, depending on where you are listening in from. I'm speaking to you from England, where we are experiencing our hottest day this summer at 34 degrees. Which in London feels extremely hot. So I've got a cooling fan on here and trying to keep myself chilled to be able to do this presentation. I welcome you all to the presentation, and I would encourage you to add any comments or questions as we go through the presentation. I'm going to talk a little bit about the findings from one of our Thinking Space events, which focused particularly on promoting positive parenting, and just briefly to say that the aim of this is essentially to bring together across our international world of child protection, thinking about sharing theory, research, and evidence-based practice such that we can bring together a report which is useful for all of us, informed by multicultural, multilingual and multidisciplinary input. It has universal applicability or adaptability across languages and cultures, particularly sensitive to the realities of different resources, and can be used as a resource for senior practitioners who would wish to influence policymakers and senior officials, as well as obviously policymakers and officials themselves. So some of you may be in that category. Just to remind you that, of course, positive parenting and promoting positive parenting fits very nicely within our United Nations Convention on the Rights of the Child, and in particular looking at Article 19, but not exclusively Article 19, but the right of the child to freedom from all forms of violence. I have a general comment which sets out more practically how we can implement Article 19, which ISPCAN was involved with other bodies in, and it sets out some of our international obligations, and in particular in relation to promoting positive parenting, a recognition of children's right to protection from harm and to family life, but also from looking at it from the parents' contribution to helping bring up children, that they provide appropriate guidance and direction, critically in a non-violent manner, provide materially for children, and enable children to be heard, such that the emphasis is on parental nurturing, providing structure, recognition, and being empowered, and it shifts the emphasis from parental authority to parental responsibility. So I'm bringing this presentation to you really within that context. The general comment 13 recognises the primary position of families, including extended families and child caregiving, and the protection and prevention of violence. It also recognises that the majority of violence takes place in the context of families. Therefore, that's where intervention and support are required when children become victims of hardship and distress imposed on or generated in families. And for these reasons, we believe it's really important to focus on improving the quality of caregiving and helping parents such that they are not in a position of abusing their children. Going back to Pinero's really landmark study that was done in 2006, also this recognised the family as the natural environment for the growth and well-being of all its members, and particularly children, and recognising that family has the greatest potential to protect children and provide for their physical and emotional safety, but also recognising that the family is the most private of all spheres. And so I think people will realise that when you're intervening, and particularly in relation to how parents bring up their children, that in I think virtually all societies, the privacy of the family is regarded as being almost sacrosanct in some societies, and therefore very difficult potentially to intervene in a way that is supportive and helpful. Maria Santos Pais, the UN Special Representative to the Secretary General on Violence, has also emphasised the importance of the family in violence prevention and in the protection of young children, and emphasising the importance of family love, affection and supportive advice to help children develop trust and confidence, nurture their self-esteem, and promote a growing sense of responsibility that gives competence to overcoming challenges and solve disputes without resorting to violent means. Providing a nurturing environment for children in early years and supporting parents and caregivers in their child-rearing responsibilities is critical to child development and protection from violence. And I'm sure, as many of you may know, there's a huge emphasis in relation to promoting positive parenting on particularly promoting that from really pre-birth, from conception onwards, and within the first 3 years of children's lives when their brains are developing in a rapid way. We also know from the studies on adverse childhood experiences that abuse and neglect during childhood may have long-lasting and severe impacts on both later childhood and, importantly, into adult functioning. So more evidence of the impact not only on children, but then into one's adult life. This is, I think, a helpful definition that was provided by the Council of Europe back in 2007 when they were commissioning a piece of work looking at how to support and promote positive parenting. Positive parenting is parental behaviour that respects the rights and best interests of the child. The positive parent nurtures, empowers and guides children, recognising them as individuals in their own right. Positive parenting is not permissive parenting. It sets the boundaries that children need to develop to their full potential. And a key part of positive parenting is raising children in a non-violent environment. And I think the wording of that definition is very helpful, because sometimes positive parenting is regarded as being, as it were, soft on children or not providing enough discipline, when the critical thing is, of course, providing boundaries and supporting children, but in a non-violent way. There's some recent evidence from a colleague here in London, Peter Bonnigy and his other colleagues did a research an overview looking at the evidence from conduct disorders, and they were talking about the importance of positive parenting or parent training, which is a family-based intervention where parents are encouraged to focus on pro-social behaviours rather than the elimination of conduct problems, social learning and relationship enhancement. These approaches have been widely tested in individual and group settings in the real world. Some specific programs which some of you may have been involved in relate to Incredible Years, Triple P, Positive Parenting Program, Oregon Social Learning, and Parent Interaction Therapy. Whilst these programs have been found to be effective in most families, there needs to be a recognition that they are not necessarily effective with all families. In some quarter, it's not considered to be effective for a variety of different reasons. And when implementing programs, it's important to look at these reasons and think about them in terms of drawing on the evaluations of these different programs. And I think this slide is absolutely critical in terms of bringing together our understanding in relation to the importance of what we do and the training that we might provide, the support we might provide in relation to positive parenting. And that Fonagy and colleagues found it was the reductions in harsh or negative parenting, which was a key factor in mediating change in child problem behaviour. And the reduction in punishment is necessary, but not a sufficient condition for improvement, whereas positive parenting is a necessary change. So pointing really very clearly to the importance of obviously not only reducing the way punishments for children, but also thinking of other ways in which children can be positively parented. So we see, again, coming back to the document the Council of Europe produced in 2007, that positive parenting can provide nurture for children, provides their structure and guidance, recognition of children and valuing them as people in their own right, empowering children to have a sense of their own competence and personal control, and also, as we keep coming back to, having a experience of a non-violent upbringing, which includes all corporal or psychologically demeaning punishment. So when we think about the programs or the interventions we might put in place, this is what we are hoping to achieve. So our thinking space, which we have done every second year, is focused in 2015 on positive parenting, preventing violence against children and breaking the cycle of interpersonal violence. And this report and our previous two reports on focusing on child sexual abuse can be located on our ISPCAN website. So for this particular piece of work, it began with a workshop back in January 2015. We used a snowballing technique to gather information via survey, and then webinars like this and conferences such as the one we're about to have in Prague, and regional conferences to make contact with additional informants. And this data was analysed in a report prepared in 2016 by a colleague, Enid Hendry from the UK, and other ISPCAN colleagues. Now, in terms of our responses, we got responses from 23 different countries from all 5 regions of the world, and it was representative across gross national incomes, human development index. Most responses came from NGOs and universities, but it was a heterogeneous sample from practice, research, training and evaluation, plus international experts. And as I speak about the findings today, I'll put them into a slightly broader context of other work that really supports the findings from our survey. So this survey provides insights from across the globe, from richer to poorer countries, the least developed, although most of the responses do come from the wealthier countries in the Northern Hemisphere. So it's a small sample in global terms, but the diversity of respondents provide a rich variety of perspectives and insights and raise a number of critical issues for exploration. This is the cover to the report, which you can download, as I said before. And I'm going to now focus on some key findings and recommendations from that report. Interestingly, there was a broad consensus internationally about what is meant by positive parenting and its core elements. And if we think back to how that was defined by Council of Europe, it gives us some kind of idea of what kind of things people might be thinking about. But it does mask significant differences of emphasis, focus, and interpretation. And keeping a child safe from harm was mentioned by less than 25% of respondents. So oftentimes thinking about positive parenting, the box that people put that thinking into doesn't necessarily enable them to also think about the actions that you take and how you might keep children safe from home. And yet we see from the earlier research findings that I've just presented and many other sources that really supports the importance of positive parenting, both in terms of nurturing children in a positive way, but also preventing violence and harm to children. I think this slide is really very important. There's a strong consensus that cultural norms and practices are hugely significant when promoting positive parenting. So there were 4 main themes that emerged from the survey. There were differences of cultural norms and practices within and between countries and communities in relation to parenting, the implications of this for programs. There were differences in terms of which norms were seen as having the greatest impact on positive parenting, and whether cultural norms and practices are seen as positive or negative in relation to positive parenting. There are examples of where some practices may be seen as a positive in terms of how you parent, and that's particularly in relation to corporal punishment, and other societies in which that is seen as a definite negative. For example, in Sweden, which was the first country to ban corporal punishment by everybody, including parents. So periods of transition and change are seen as a challenge for parenting, and we know this as children grow up, they present different challenges for us as parents. Which cultural norms were felt to have the greatest impact on parenting? First one was discipline, methods of discipline, what's considered to be normal ways of disciplining children, gender discrimination, and related issue around male violence. So to quote Michael Marmot, again from the UK, the international evidence could not be clearer. Physical punishment has the potential to damage children and carries the risk of escalation into physical abuse. So when we're thinking about how we might implement any kind of parenting program, we need to think about the cultural norms that may have an impact on the work that we do, and in particular in these 3 areas. So the respondents considered that these were the essential elements of violence prevention strategies. So providing parenting support through the first years of a child's life is strongly supported by evidence and can improve parenting and reduce parental stress, enhance the resilience of children, and prevent maltreatment. Parenting programs result in positive effects in low, middle, and high income countries, and can be effective in reducing child maltreatment when applied as primary, secondary, or tertiary interventions. And I'm going to give some examples of those 3 different levels of interventions a bit later in this presentation. The key message is that the promotion of positive non-violent parenting should form a key element of each country's strategies to prevent violence against children and improve their developmental outcomes. And I wanted here to mention the INSPIRE program that's being taken forward by the Global Partnership. Some of you may come from countries that are partnership members of that. So the whole area of promoting non-violent parenting is absolutely critical to this initiative, and the different programs that are being promoted under that heading in order to reduce violence against children and in time to prevent all forms of violence to children. So I think when we're looking at how we have a strategy around the prevention of violence, we need to make sure that we've got positive parenting well and truly embedded within that as one of our strands. It is important that there is an alignment between law, policy and practice for effective violence prevention, and that our legal and policy framework prevents all forms of violence against children in all settings. And this should be backed up by resources, research, monitoring and data collection, because without these different components, positive parenting programs will have little impact. And it is absolutely critical that when we're implementing programs, we need to evaluate them and make sure that they are in fact having the positive effects that we anticipate and intend. Supporting developing and sustaining positive parenting requires a multi-level, multi-systemic approach, which utilizes a different number of different methods. And we know from a number of different programs that we have to be really looking at having a multifaceted approach to implementation and sustainability if we're going to get change over time. Parenting intervention programs that focus purely on the individual family context are unlikely to succeed in isolation, given that some of the factors associated with harmful parenting and violence against children are structural in nature, for example, poverty and inequality, whilst others are cultural, for example, discrimination based on gender, disability or ethnicity. So in terms of thinking about how we might take forward a strategy around positive parenting, we need to look at all the different factors within our communities, our wider society and our countries that may impact on parents' ability and capacity to positively parent their children. Now, how do we measure success? There are many different ways of measuring success, as I'm sure you know. And one of the things that came through very clearly in the study was the need for internationally derived and accepted indicators of what constitutes successful outcomes for positive parenting programs to enable targets to be established and measured and meaningful comparisons to be made between programs. Comparative studies between positive parenting programs should be undertaken to assist commissioners and practitioners to make informed choices. And interestingly, few studies of positive parenting interventions currently measure actual child maltreatment outcomes. So we need to think about what our measures are and how we measure success. And another important really finding is the importance of doing longitudinal research studies of positive parenting interventions to determine their effectiveness over time, including the preventing of transmission of interpersonal violence across generations. And I'm sure you'll be all well aware of the difficulties often of securing funding for longitudinal research that is so essential to know if what we are doing makes a difference over the generations in the prevention of violence. So we need to think about transferability of programs between countries and cultures. So while there's now good evidence for the applicability of parenting interventions across cultures and countries, it should not be assumed that an unadapted program which has worked in one context can be effectively replicated in a new setting. And there's a caution that full-scale programs should not be rolled out in a new context or culture without due consideration of the need for adaptations. And this may include adaptations that relate to the law, that relate to cultural norms, as well as linguistic use of terminology. And where possible, there should be the pilot studies which are rigorously evaluated to determine relevance and cultural appropriateness, as well as to identify any necessary adaptations which should be made before scaling up and rolling out the program. And I think the idea of trialing something identifying what might need to change, what works, what doesn't, is critical before rolling out any program. Now, in terms of selecting interventions, not all positive parenting programs are equally effective in preventing violence against children, nor in addressing different forms of violence. So in selecting a specific intervention, commissioners and practitioners should check that the intervention is effective in addressing the issues for which it's intended and critically review the quality of the evidence. For example, some programs may have a positive impact on a child's pro-social behaviour or improve educational outcomes, but lack evidence on violence prevention. Some may be effective in reducing harsh physical discipline, but may not necessarily reduce neglect. So in deciding whether to mandate or roll out a particular model of program, critical appraisal is needed of program evaluations, including their degree of independence from the developers of the program, sample size and setting. So I thought this figure, which is comes from Northern Ireland, looking at some of the things you need to consider when commissioning evidence-based approaches, seem to me to be very helpful in identifying what approach we want to use. So thinking about what's the problem or outcome we want to change, what causes or adds to this problem, what approaches improve these outcomes, what are the needs and strengths in our locality, how is the problem experienced and perceived, what do key stakeholders think should be done, and will this work here with our client group? Very important point. Things may work in one place, in one cultural context, even within a country, but not necessarily translate across. So in terms of addressing gaps in positive parenting internationally, the contribution of internet-based positive parenting programs is under-researched. One study found that an online program led to reductions in harsh coercive parenting and could be part of a stepped care model to promote positive parenting. There's a small but growing body of research suggesting that parenting interventions aimed at improving parenting in low-resource, culturally diverse countries and in post-conflict settings may be both feasible and effective, but more development and research is needed in these settings. Another key point is that parenting interventions still tend to target or be more successful in engaging mothers rather than fathers. And this is certainly the case here in the UK, and traditionally mothers have been involved, not fathers, although we're trying very hard to redress that. There are some positive developments in the report itself on which to build, and commissioners and practitioners should actively strive to support and engage fathers as well as mothers. And I think there are some good examples of where fathers have been engaged in programs. For example, I know the Mellow Parenting program works hard to engage and is successful in engaging fathers, and that has been very fruitful and rewarding for fathers as well as those undertaking the training. There's relatively little attention being paid to the provision for the following groups where there are known risk factors for violence: young teenage parents, parents of a disabled child, and parents of adolescents. The research itself identified a number of areas where there were barriers to implementing positive parenting programs. Funding was critical in all contexts. Parental engagement and participation is also important. Social and cultural attitudes. Workforce, and I think that relates to workforce having the skills and competence to deliver programs, deliver training. Oftentimes there's a lack of political will. This can be at a more localised or national level. Major stresses on families that may impact on their ability to engage with programs, having an inadequate legal policy and standards framework, and inadequate resources. So I just wanted to draw your attention quickly to the World Prospectus that was edited by a colleague, Howard Dubowitz, for ISPCAN, produced in 2016. And this also, at an international level, discovered that policies were not widely enforced and services were inadequate and government support lacking. So that was across the board, but in all countries. And there's a compelling need for societies to strengthen families, to support parents and caregivers, promote children's health, development and safety, and prevent child abuse and neglect. So what was showing through our survey in relation to positive parenting was some issues around getting good government level input, having the financial capacity as well as the human resources capacity to build and strengthen the families. And this finding was also part of our findings from broader study that came through in the World Prospectus document published in 2016. So these issues, and I think they impact on every country, even the so-called wealthier countries, is always an issue, particularly around getting funding for positive parenting programs and supporting parents more generally. So that, just to sort of almost state the obvious, financial and human resources are required to support work with children and families. And in my experience, too often financial decisions are made without considering the consequences for children, that short-term financial gains can have very serious consequences for children's outcomes. And in particular, securing investment in early intervention can lead to cost savings, but the benefits for children take time to be demonstrated. And I think this is a very important thing to consider when one's evaluating positive parenting programs, because sometimes it's hard in terms of if you're actually preventing something, it's very difficult to show that the benefits in terms of both outcomes for children, but also financial benefits, which are usually the ones the politicians are most concerned about. And so we need to think about how we can demonstrate through our evaluations the impact of the financial investment in these programs and the difference it makes to children and families' lives. And one of the really nice quotes I like to use quite a lot comes from Maria Santos Pais, who states, with relatively modest investment in proven strategies for violence prevention, a long-lasting difference can be made to protecting children from violence. The EU has calculated that every euro invested in preventing violence produces a social return of 87 euros. And Maria makes the all-important point that in a time of austerity, investing in violence prevention is a question of good economics. And I think that calculations obviously been done for the EU. There other information from the United States, and increasingly through, for example, WHO and the Global Partnership are really trying to look at the economic case for prevention of maltreatment, and therefore the importance of promoting positive parenting as part of achieving that. So that when we're talking with our politicians about funding these kinds of programs and initiatives, it's important to be drawing on the evidence that one can from economics, as well as obviously from more social science type research. This is one of my favorite slides, because when one's thinking about how to intervene across the different levels, I think it's really important to be thinking about how we can intervene prior to the occurrence of abuse or neglect through universal and targeted services, to prevent recurrence of abuse or neglect where it's been identified, and prevent the impairment to children who have been abused or neglected. And interventions can happen at all these different points in time, where all the time we're focusing on improving long-term outcomes for children. Obviously, Macmillan and colleagues have a whole paper around that was published in The Lancet in 2009. And I know that this particular diagram is much repeated, and particularly my colleagues from WHO very much favour its use in terms of thinking about how we can intervene in relation to primary, secondary and tertiary prevention. And there are some examples of literature, dominantly from European programs, but it's also relevant, of course, in the international context and through INSPIRE, global initiatives that's going on, their work to think about how we can intervene in these different levels to prevent the occurrence of maltreatment, of which then thinking about how we can promote and sustain positive parenting is absolutely critical. So we need to think in terms of our interventions, focusing on the child or young person, parents and caregivers, family, perpetrator of any abuse or neglect, because they are an important key audience for changing behaviours and thinking about how to help them positively parent as well, the wider family context as well as the community. So some examples, I just give examples under each of the different levels. Some of you may be very familiar with the Swedish example, where they banned physical chastisement in 1979 and evaluated it some 15 years later, and I understand it's been evaluated again relatively recently. So 15 years after the Swedish ban, there was public support for punishment having declined, that only a third of middle school children reported physical punishment from a mother or father, mostly the mildest forms. 3% of the population surveyed had received a harsh slap and 1% had been hit with an object. Young children were less likely to be suspected of physical abuse, and no child has died as a result of physical abuse. And since the Swedes led the way, there are an increasing number of countries who are implementing this ban. And so we have a growing movement, I think I would call it, to actually help society and members of society recognise the importance of not using physical chastisement for children. Thinking about secondary prevention, some of the most effective targeted approaches to preventing abuse and neglect appear to be home visiting programs and multi-component interventions that are used in parenting, parent training. Home visiting programs are very important. David Olds in the US developed home visitation in the 90s. This was implemented more widely under the banner of Family Nurse Partnership in the UK, and I know that's been taken forward in a number of different countries. It's been found to be effective. There are also other parent training programs, and just to name a few where there is good quality evidence of their effectiveness, the Triple P program, Incredible Years, and Mellow Parenting all have good quality findings about their effectiveness. And then when we think about tertiary prevention, some are focused on parents themselves. For example, the Parents Under Pressure program that was developed in Australia by Dawn Harnett. That has also been tested out in the UK by Jane Barlow and colleagues. It's very useful for parents who are experiencing difficulties with drug and other types of substance misuse, and helping them from the point of knowing that they were going to be having a child, so pre-birth through to the early stages of a child's life, such that we're helping to parents to give up their drug use, their substance misuse, and think about how they can positively parent their children. Another technique of focusing on parents' children is as effective as video interaction guidance, and that's not used, in fact, in a number of different other types of interventions as one of the components of them. Family-focused interventions, a good example is multi-systemic therapy for child abuse and neglect, which is quite a specialised program for intervening where there's been abuse or neglect of a severe nature, and again has a focus on helping parents learn new ways of parenting their children. And then ones that focus on children, specifically the multidimensional treatment foster care, which also has a good track record in working with foster carers, birth families and children where there has been such severe abuse or neglect that the children need to be removed from their family. So those are all interventions that do require staff to have specific training in the method of intervention and require fidelity to the particular model. So this work that was undertaken for WHO on evaluating outcomes of parenting programs, I think it was very useful in looking at what are the important components of the different parenting programs. So they give opportunities for parents to practice new skills, teaches parents principles rather than prescribed techniques, teaches positive parenting strategies, including age-appropriate positive discipline, and considers difficulties in relationships between adults in the family. And there's been some recent research that's come out looking at the impact of poor parenting relationships on children's development, which really supports the notion of looking at relationships between adults, parents or caretakers, as well as looking at the relationships between the caregivers and their children. This chart is taken from the European Report on Preventing Child Maltreatment, which was produced by WHO Europe, and sets out a number of different programs, some of which have been tested in the European region, but are all evidence-based programs from some part of the world. And these programs have been shown to be effective in relation to prevention of violence, and with a particular focus on helping parents do things differently with their children. And I would commend that report and associated documentation to you, as well as the Inspire handbook that's just been published, to think about methods of intervention that will be effective and whether or not they might be effective in your particular country, or how you might need to adapt them for use in your particular country. So just again looking at what the main features are of effective programs, that they have a sound program theory underpinning them. They clearly define a targeted audience, and I think it's really important to always look at the research findings for a particular intervention, to be clear that you understand, if you're implementing a program, who it's designed to work for, which populations have been effective, because it will not be cost effective, nor will it be good for the children and families you work with to be using programs which are not targeted at the particular client group you're working with. These need to be appropriately timed so that they're offered at a time that's acceptable to the children and families. There need to be sufficient sessions undertaken. For example, if a program says 6 sessions, it means carry out 6 sessions rather than 1 or 2. And that's why it's also important to try and engage with families such that they do complete the program. Critical to all of this is having well-trained and well-supervised staff. And the theme that keeps coming through in all the work is the importance of monitoring and evaluating programs to make sure that they are in fact doing what you ask of them. And as we would say, doing what it says on the outside of the tin. So there's quite an important component of being sort of having implementation fidelity, such that the programs are implemented and then used in the way that they have been intended to do. Important to adhere to the program so that it's delivered as designed, with all the core components to the appropriate population, staff trained to the appropriate standard, the right protocols, techniques, materials, and prescribed locations or contexts. I think that in essence means there are no shortcuts to adhering to a particular program. Again, the issue about the exposure is the treatment dose needs to be appropriate for and what matches the original program. I think sometimes this is perhaps underestimated, the importance of the quality of program delivery. The manner of delivery by those who are delivering the programs, the skill of leaders in using techniques and methods, importantly, their enthusiasm, preparedness and attitude, motivating the children and families they work with, giving them hope for the future is a really key component of effective outcomes. It's important to have participant responsiveness, and this is about the extent to which participants are involved in the activities and the content of the program. And I'm sure those of you who've been involved in various programs will know if participants don't feel involved, they don't feel it's got something for them, then they won't continue to come back. And program differentiation, which is the extent to which all of the unique features of programs are identified and present. So using role play, practice and within sessions and setting homework assignments to consolidate learning. So I just want to speak about a particular program that I'm involved with in the UK called Hope for Children and Families, and draw your attention to one of the intervention guides on promoting positive parenting, which we see as being critical when one's addressing neglectful parenting and also helping parents and their caregivers working with children perhaps who've got emotional and traumatic responses and addressing disruptive behaviour. And importantly, see the intervention guide around positive parenting as being critical to any program that might be rolled out, irrespective of the severity of abuse or neglect that's being suffered. For this sort of front-end prevention, promoting positive parenting would be sort of one of the first ports of call when you're designing an intervention for a particular child and family following assessment. And where you're concerned about severe abuse or neglect, clearly it's important that the child is safe, or the children in a family are safe before implementing any other types of interventions. Sometimes by helping parents find more positive ways of parenting, they could feel success for themselves and therefore have an understanding that they have the capacity to change, they can do things differently and can see the positive benefits it has for their children and for themselves as parents, to get enjoyment out of being parents and seeing enjoyment out of seeing their children be happy and fulfilled in their development. So in terms of my experience of implementing these programs, there are some key messages that I think go across all programs, and that you really, if you're doing an implementation strategy, you have to have commitment and sign off from senior managers. Very difficult to implement any program in an organisation without senior management engagement. And that means having clear and effective communications up and down your system, from those who are on the ground doing the work through to the most senior managers, having clear targets and identifying the range of practitioners with different needs and different parts to play in the implementation, such that any program may target and be delivered in a way that's appropriate for the role of the different practitioners and managers within the organisation. Critically important in any program implementation is to have an internal champion who's going to take forward and champion this program, to have a project coordinator and a project plan that supports practical planning for implementation. One always underestimates the amount of work it takes to actually organise and project plan and continue to monitor and make sure things are on track for any implementation of a training program, and also for doing the evaluation of that program, that you need people who have got a key role in coordinating that and working to an agreed project plan, which of course needs to be reviewed and refined during the life of the project. It's also important that those who are your core training group, those who are doing the training and leading the training, have champions, and that your practice leads, those who are championing the importance of change or some sort of adaptations to current practice, are involved in shaping any kind of training to meet the needs of the service, such that the people being trained feel that the program has something to offer for them and the children and families that they work with. They understand its importance for their work and can really relate to it throughout the whole program. And the role of champions is critical to help kind of keep up that momentum, keep up the enthusiasm, especially through the sort of sticky times where new ways of working are being implemented and people may be struggling to do things differently. Some messages that came through to us from line managers and practice supervisors was that it is really critical to have this internal and external support, both from those who are the program implementers and also within their own organisations. We have certainly found that any kind of training needs to be supported by clinical or practice supervision groups taking place on a 2 to 4 weekly basis, such that they have good reflective supervision and the learning that's done can be reinforcing and reinforced by these supervision sessions, and that people have a chance to kind of ask questions, think about what they're doing, things that may not go well, draw on not only their practice supervisor or their clinical supervisor, but those in their peer group, to enable them to kind of overcome some of the challenges of learning new ways of working. I think any kind of sort of formal training done in a workshop needs to be reinforced through these practice supervision sessions on a regular basis, and that those who are providing the consultancy or supervision to the program need to support the champion practice and line managers such that everybody is getting help to implement a particular program in the way that it is intended. And this is critical for fidelity, but it's also critical for sustainability in the longer term. So just going back to the report itself, from ISPCAN, the Thinking Space report was recommending that all strategies to prevent violence against children should include the promotion of positive parenting. Definitions of positive parenting should explicitly refer to non-violent parenting approaches and the provision of safe home environments, and that law, policy and practice should be aligned and give consistent messages. All forms of violence against children are unacceptable. And some messages for policymakers, funders, commissioners and practitioners, that they should satisfy themselves that a parenting intervention is effective in addressing the issues and context for which it is intended, and to do so by critically reviewing the quality and applicability of the evidence. The training should include skills of facilitating adult learning and motivating parental engagement, and not simply focus on program content. That the information about which positive parenting programs are available and are being adopted in various parts of the world and with what results should be collated and disseminated internationally. And I know that that's something through the Global Partnership. They're working hard to make this information known across the board for everyone to be able to access, as well as being able to think about how they should implement within their own contexts. And that measures should be taken to encourage innovation and the development and evaluation of locally grown programs, particularly in culturally diverse and low and middle income countries. So I think we've come to the end. Thank you very much. I had a thank you slide, but that seems to have gone. So I was also just trying to quickly look at my questions.
Yes, thank you, Jenny. Let me go back to my screen here. I can see these questions. Okay, we've got a couple questions. One participant is wondering if you could talk a little bit about the conceptual difference between positive parenting and positive discipline.
Can you hear me?
Yes.
Thank you. Well, I think it depends a lot on how you define discipline. Traditionally, in many societies, discipline has been taken to mean discipline by the use of force, by the use of an implement, a hand, rather than thinking about it in relation to positively helping children learn new ways of working, which we would term to be positive parenting, learning how to enable children to learn right from wrong and pro-social behaviour in a non-violent way. So a lot of it turns on your definition of discipline and whether that's only seen in terms of physical discipline, physical chastisement, or whether you see it much more broadly about providing guidance and boundaries for children as they grow up.
Okay, thank you for that. Another participant is asking about whether you know of any global data available that, hold on one second. Sorry. That points to the impact of negative parenting as it relates to the rise of ODD or oppositional defiant disorder and CD or conduct disorder in children and adolescents.
Well, I think the findings that came from the review of the evidence in relation to Peter Fonagy was talking about, that was looking particularly at conduct disorders in children, and they were addressing the issue in terms of the negative impact of negative parenting on children, and therefore if you're trying to address conduct disorders, you need to have positive parenting as well as a reduction in the actual harsh disciplining of children. So usually we as clinicians see children after they've got a conduct disorder problem, for example, and we're asked to intervene. As a society, we can be thinking about how to prevent that developing in the first place through the positive parenting programs.
Okay, thank you. And maybe just one more question. One participant pointed out that many children are not raised by their biological parents, and I'm wondering what the research is related to parenting programs for caregivers as opposed to biological parents.
Yes, I think parenting is used generically in this context to mean anybody who's in a caregiving position for children. So it's not exclusively biological parents.
Okay. Do there seem to be any differences in terms of success of these programs with non-biological caregivers versus parents?
I don't have any specific data on that. I think that to flip it slightly differently, there's evidence to show that if all caregivers are using positive parenting techniques, that's helpful for their children. But I don't know about the difference between biological and non-biological parents.
Okay. All right, thank you. We are about out of time, so I just want to say thank you again, Jenny, for sharing this valuable information with us today. And thank you to everyone for your questions and for being with us today as well. A recording of this webinar and a PDF version of the slides will be available on our website within 48 hours. We encourage all of you to become a member of ISPCAN if you're not, so that we can continue having informational webinars like these in the future. If you're interested in presenting or have ideas for topics, please contact us at resources@ispcan.org. We would also like to take this opportunity to invite you to join us in Prague, September 2nd to the 5th for our 22nd International Congress. Registration is now open on the conference website at ispan2018.org. Thank you again for your time today, and we hope that you all have a good day or night, depending on where you are. Thank you, Jenny.
Thank you.